Good morning. This is Joyce Briggs with the Ross programs. As you may know, I work with senior citizens and those that have disabilities. My age population is 55 and older, and we have had so much success with residents attending the PACE program. And today I have Vanessa Wall with the PACE program, and she's going to give you an oversight of what PACE is. Good morning, Vanessa. How are you?
Hi, Joyce. Thank you so much for having me this morning.
Thank you so for giving me your time today. I appreciate it. It's morning coffee with Joyce, and I have my coffee. And I don't think Vanessa drinks coffee, but that's okay. We're so glad that you gave us your time today. So Vanessa, tell us a little bit about PACE and how it all started.
So PACE is an organization that started out in San Francisco back in the 70s. So it was originally called the Unlock program, and it was a group of individuals who decided, you know, we need a better program for our aging adults, for folks who want to continue to live in the community, but also who want to socialize. So they created Unlock out in San Francisco, which then has since graduated into PACE, and PACE stands for the Program of All-Inclusive Care for the Elderly. Mm-hmm. Nationally, there are PACE organizations in several states. North Carolina has 13 PACE organizations. We happen to be the one that just serves the Triangle area.
That's awesome. And so you cover Wake County, Durham County, Granville County?
And select zip codes of Granville County. Mm-hmm.
Awesome. So you have a presentation that you have provided for me. We've looked at it before. It's wonderful. And I think that the audience would be very interested in knowing the things that you have to offer through the PACE program. So you're ready to share your screen this morning?
Yes, ma'am. Go ahead and do that now.
Awesome. So you can go ahead and get started whenever you're ready.
Okay. I'm going to minimize myself here. Bring it down. Okay, so as I mentioned, my name is Vanessa Wall. I'm the marketing manager for Volunteers of America Senior Community Care of North Carolina, PACE. And today we're just going to go over a brief overview of our services and how you can join our program. As mentioned before, we serve Wake, Durham, and a select portion of Granville County zip codes. These are identified through the North Carolina Division of Health Benefits, also known as DHB, to determine the service area for each PACE organization. So today, I wanted to show you a brief video that we have. This encompasses all the things that PACE does for our participants. A lot of times when people call us, they say, you know, we've read up on PACE, we're really interested in PACE, but what is it exactly that you guys do? We offer so much that we often in turn send this video back to the folks that are calling us to give them a better understanding. So we'll just play this. It's about 2 minutes.
This is John. John worked hard for 40 years as a welder. Now that he's retired, aren't the way he imagined them. He's got a heart condition that's been really limiting things, and over time he's put on some weight. Even little things that anyone can do for themselves are getting hard these days. This is Melissa, John's daughter. She's doing what she can to help her dad, but between tracking medications, attending medical appointments, and her own growing family, Melissa is plain worn out. She wants to do what she can for her father, but at the end of the day, she's only one person, and she fears sooner than later she will have to take him to a nursing home. But with PACE, the program of all-inclusive care for the elderly, everything is different. Senior Community Care PACE offers services and professionals to help with all of John's needs: physical, medical, social, transportation, and more. And what's great is that because John is a Medicaid and Medicare recipient, PACE is a no out-of-pocket cost program. Here's how it works. As a participant in PACE, John has a multi-person healthcare team, including therapists, a primary care doctor, a pharmacist, a dietitian, a social worker, a home care coordinator, a driver, and others. With a full team in place, there are very few gaps in his care, and John has someone to help him with every aspect of his life. Through PACE, John was introduced to Sandy, a home care coordinator, Tricia, a personal aide to give John a hand with his morning routine, Dion, who drives the wheelchair-accessible PACE van that gets John to and from his doctor appointments and the Adult Day Health Center, Robert, his doctor, Jeff, his physical therapist, and lots of other helpers. Now, John is familiar with how to take his medications. He is eating better and losing some weight. His mornings are easier. The stairs aren't as dangerous as they once were. John is regaining his independence, and Melissa has some relief and can focus on enjoying visits with her dad and spending more time as a family. Because now their family is part of the Senior Community Care PACE family.
Quick overview of the services that we offer and how it all kind of comes together. So PACE is an integrative comprehensive care model. We think about the more efficient use of healthcare resources, the better off our participants are. So in the middle here, you'll see our core services, which is going to be primary care, social work, home care, nutrition services, rehab, day center, transportation, prescription medications, and medical specialists. And of course, the person in the middle is the participant and their family. The reason we have that in the middle is because we're very person-centered, and PACE is a partnership. We do not run the show on your healthcare needs. We are simply here to support you in what you would like to do with your health. On the right and left-hand side, we have other additional services such as audiology, dentistry, optometry, podiatry, durable medical equipment, speech therapy, and skilled nursing care. To become eligible for PACE. So to participate in PACE, an individual must be enrolled in Medicaid only. So that would be someone who's under 65, be enrolled in Medicare and Medicaid, and that's what we call dual eligible. Or have the ability to privately pay. So currently the private pay amount is around $4,884, which does seem like a lot of money, but for someone who may be paying privately for nursing care services, 24 hours a day, 12 hours a day, you know, that can add up pretty quickly, and $4,800 can look like a pretty good deal after it's all said and done. To participate in PACE services, an individual must be 55 years of age or older, meet the state's nursing home level of criteria, reside in one of our PACE organization service areas, so it's going to be Wake, Durham, or a portion of Granville County, and be able to live in the community setting when enrolled without jeopardizing health or safety. What that means is we want to make sure that someone is able to live alone without 24-hour supervision or the need for support, that they're safe when they're alone. So as I mentioned before, we are dictated by our zip codes. So just to make it a bit more clear, these are the zip codes that we have for each county and the map that outlines each county. Occasionally we'll get folks that call who are right on the border of Johnston County or Chatham County or Orange County, and there's just not much we can do if they don't fit within one of these zip codes. So as mentioned before, PACE is a team approach to care. We do have our interdisciplinary team that meets every day. We have what's called an IDT meeting each morning, and we meet to discuss participants and their needs. So each member of the team has a unique perspective on the needs of each participant, from providers to social workers. Each team member brings an expertise and feedback to the table. So what a social worker might see, a provider might not see, or a nutritionist might see, the speech therapist might not see. Because our team meets frequently and interacts with each participant so often, whether it's during a PT visit or while they're on the bus or coming in for a clinic visit, we can catch even the smallest issues and begin treatment to prevent them from becoming bigger issues later on. All decisions made by the team are based on what's best for the participant to keep them as medically, physically, and socially stable as long as possible over the long term. One thing I love about this particular slide is showing the heart of people. So we talk about the interdisciplinary team, the family, the participant, but it really does take a community. So what you're not seeing is the extended family members, the contractors that come to support a home modification, the church members, the neighbors. These are all part of a bigger system that help PACE participants continue to remain in the community. So as mentioned in the video, we do have an on-site PACE medical clinic. So all primary care takes place within the clinic with our providers. So that is a caveat to joining the program. Meaning if you've been seeing a doctor for 20 years and you don't want to change your doctor, PACE may not be the right choice, because unfortunately you would have to change your doctor to one of our PACE providers. We have medical personnel on call 24 hours a day, 365 days a year. And currently our specialty medical care is provided from our network of community specialists, and that is going to be through Duke Health. So again, if you are seeing a specialist through the UNC system or Wake Med, you would need to transition those providers over to the Duke Health system. And that would be something like a cardiologist, urologist, endocrinologist, something like that. Mm-hmm. In addition to the PACE Medical Clinic, we have pop-up clinics that come directly to our center. So they provide dental care, podiatry, audiology, optometry, and geriatric psychiatry on an in-house rotating basis. Here are a few pictures of our day center. Unfortunately, we didn't take these pictures while folks were at the center. We took them after hours, but they are set up specifically for socialization. Each table has about 2 to 3 folks sitting together. A lot of times people will form friendships very quickly when they join the program. Coming to the PACE Center is not a requirement to join PACE. It's just to me, one of the best things that we offer. I do like to explain each day room is a little bit different. We have 4 day rooms at this PACE Center, and participants are divided among each day room by their level of care. So one day room may be very active, self-directed, not as many CNAs to participant ratio, whereas our most, the rooms will progress to having more CNAs to participants as their needs change. So one of our rooms could be hands-on assistance, help with feeding, help with activities. Our activities coordinators that are on site use activities that focus on things like fine motor skills, spatial reasoning, and cognition. In addition, they read current events, have fun outings, pull groups together, and entertain participants with dances and music. We often have a lot of fun with music and getting people together, just trying to encourage as much movement as possible. But you can always check out our Facebook page and see some of the latest current events that we've had. Of course, COVID has changed some of this, and we're doing the best we can to keep our participants safe, but also keeping things as fun as possible. Personal care services and home health. So we do provide home health services in the participant's home. That is based on an assessment. So each participant will have an evaluation prior to enrolling to determine the level of care that they would need. Our program is a little bit different because we are considered task-based. So whereas other programs may say, we're going to offer you 2 or 3 hours a day, our services are directed specifically to each task. So if someone needs light housekeeping, help with a bath, and some meal prep, as soon as those 3 tasks are completed, that CNA would then leave the home. So however long it takes for those tasks to be completed. Once an assessment is completed, we create a home care plan that outlines those specific tasks that we've identified, and then take that back to the team. Therapy services is one of our most popular services that we offer. That's going to be physical, occupational, and speech therapy. Physical therapy helps participants maintain an appropriate level of strength and mobility. They complete assessments, do individual therapy, group exercise classes, and strength and balance. Whereas our occupational therapists are folks that come in and determine, how can we help you in the home? How can we reduce your falls, customize intervention, and adaptive medical equipment to help you just get around a little bit better. And of course, PACE provides all durable medical equipment. At the bottom here is just an example of some of the things that we provide. And our therapy department also does repairs. So if you come in with a wheelchair that you absolutely love, but maybe the wheel's a little bit wobbly, you can bring it in, trade it in for a day. They'll work on it, get it fixed up, and give it right back to you. Transportation. PACE provides transportation primarily to and from our day center, but on top of that, we also support each participant with getting to their specialty appointments. So typically a loved one may take some time off of work to drive you to a cardiologist appointment. They may no longer need to do that because PACE can come pick you up, drop you off at the appointment, take you back home, and not have to involve someone who may have typically needed to take off work. We can support you with having a nurse stay with you as well. Our PACE drivers are specifically trained with our occupational therapist and physical therapist to ensure the safety of each participant. So as you see on the left, there is a lift that comes down for our buses, and our vans are also accessible. Drivers are some of the most popular people that work at PACE because they get to know the participants and their families pretty well because they're meeting with them on a more frequent basis. And currently we have about 16 vans and buses on board. So the PACE basic rule, basically the PACE benefit package for all participants, regardless of their source of payment, must include the following. So primarily anything Medicaid and Medicare cover, we would also cover. With the caveat of, since PACE is a capitated program, we're also able to get a little creative with how we pay for certain services, specifically as they relate to health and safety. So we had an example of someone whose air conditioner who just quit in the middle of summer. We were able to get that repaired for that individual as part of their care plan because, as you know, it's just really hot here in North Carolina, and that wouldn't be too helpful to have someone living in a hot home. So that was something, just an example of how PACE can support families. What is the PACE logic? The PACE model is centered around the belief that it is better for the well-being of seniors with chronic care needs and their families to be served in the community whenever possible. The list below is just basically the most common diagnoses that we'll see coming into PACE. And these are also the most common diagnoses or issues that folks have that keep them from living as independently as possible. They may go into the hospital several times a month just to try to keep up with what's going on. So PACE wants to aggressively manage these acute conditions, stay on top of them, and keep them out of hospitals and institutions. What does the average PACE participant look like? So average age is going to be 67. ADL deficits is going to be 3. So that would be something mobility, bathing, dressing, grooming, eating, cognitive impairment. 49% have cognitive impairment. 5.8 have, PACE participants have on average 5.8 chronic conditions, and 95% of PACE participants are able to remain in a home setting. We do have a small percentage of folks that live in a nursing home setting, but they are still able to come to the PACE program and participate in the PACE program fully. They just need a level of supervision, such as 24-hour care or supervision overnight that is just more helpful for them to be in a secure setting. So what does the enrollment process look like? Well, to start, we usually have someone inquire over the phone, through email, or through our website. Our enrollment specialist will speak with those individuals and complete what's called an intake assessment. That's going to be done over the phone. That's where we gather just some relevant information about your health and then talk to you about some finances, whether or not you would be eligible financially to qualify for Medicaid. Next, if everything checks out, we would invite you to do a clinical assessment, and that's currently being done virtually. However, we do invite folks to the center if they don't have the capabilities or technology at home. We will come pick them up through the PACE transportation. And the clinical assessment is going to be completed through the provider and a social worker. Takes about an hour. Once that's completed, we will have folks come visit you. So we'll have our occupational therapist and registered nurse come to the home. Occupational therapist is just going to be looking for how can we keep you safe? What kind of equipment can we put in the house to help you be as independent as possible? The registered nurse is going to assess how much home care you're going to need. Once all that's completed, we draft up a care plan and an initial service package, and we present that to the participant and their family. Once that's agreed upon, we then do an enrollment signing and have folks join the program at the first of the month. So even if everything were to be completed on the 15th, we would still need to wait till the 1st, and that's just something that's governed by CMS. So thank you so much. Again, my name is Vanessa Wall, Marketing Manager for Senior Community Care of North Carolina. If you are interested in PACE, here are a few contacts that you can reach out to. Our email is ncenrollment@voa.org, or you can call our enrollment line at 919-425-3050. And of course, reach us on the web or follow us on Facebook.
Could you leave that up for, so if someone reads a little bit slower? And you have been wonderful. You're so thorough. I think that's anyone that needs care for their mom or dad, or if they want to come out and say they need help on their own, I think you're the right place to go. I have several seniors that are already attending PACE, and they love it. Things have changed since COVID, but I'm sure that things are going to get better in the days to come. Thank you so much for giving us the opportunity to learn more about PACE. Is there anything else that you need to say before we sign off?
I don't think so. I just really appreciate your time and look forward to serving anyone who's interested.
Great. Well, thanks so much, Vanessa. You have a wonderful day, and I'll talk to you real soon.
All right. Thank you.
Thanks, everybody, for listening. Don't forget to like this video, share it, and add any comments that you would like to make. And if there's any questions that we can answer, I'll forward them to Vanessa and she can respond to you. Thanks so much. Have a good day. Bye.